We're here to Domestic Violence High-Risk Team Report. This is 5 years in the making. This report will give you an overview and an analysis of the accomplishments of the team. What I want to say is we're here to highlight good results, but I also want to keep our focus on the fact that we're in a continued state of emergency around a number of things. We have a homicide crisis at the moment, so both things are true. This team has been incredibly effective, and you'll hear from all of the partners today. For me, the team represents best practice. You know, 30 years ago, we didn't have a tool that could tell us who was more likely to be murdered. We had intuition back then as advocates. We'd listen to what survivors said, but we didn't have a tool. Today we have the LAP, the lethality assessment protocol, that's implemented by officers at the scene, and then they screen in and give us a score. So we know today much more about people who are facing lethal violence, so that's good news. The other good thing about the report is that in the 5 years of operation, the team's only lost one client to homicide. So it's incredibly effective. They work extremely hard. The team is made up of Sojourner, the District Attorney's Office, Milwaukee Police Department, and the Department of Corrections. We partner with other people throughout the process. Basically, twice a week they get together and they review about 40 cases to try to prevent that homicide from happening, and they've been incredibly effective. The bad news is we are facing way too much lethal violence in the city of Milwaukee. That team really should be and could be meeting every single day. There are way too many cases for the team to review. So the good news is very effective, incredible at preventing the homicide. The hard news is it's underfunded, and they really should be looking at cases every single day. In terms of what we're facing, as I've seen in my almost 40 years of work, I don't even have vocabulary anymore to describe the circumstances that we're facing. COVID has caused such disruption and disconnection. The economy is uncertain, increase in violence, easy access to gun, extreme uncertainty about the future, and hateful public rhetoric has created this sort of toxic environment. And the hard news about violence is the good news is it's a learned behavior. The bad news is it's a learned behavior. Today, right now, we have way too many kids who are growing up and adapting by using violence, and they're living out into that legacy. So this team is on this end of the spectrum, trying to deal with lethal cases. I want to live in a society where we can be preventing at the root cause. You'll see some future directions in the report. We're thinking hard at Sojourner about what we need to do with our own work. As I said, I already mentioned we need increased capacity for divert. The team should be really meeting every single day. We need increased outreach to survivors. What you see when you look at homicides is the majority of people who are victims and the majority who are committing this harm are not connected to entities in our community. We have the power to change that in this community. We need increased collaboration and increased connection. So at Sojourner, we're looking at how to evolve our work to on-scene response. We believe we've been working with MPD at the scene since 2006. We do follow-up. I think that work needs to evolve to on-scene response. The sooner we can get there, the better for that survivor and the people who are struggling in violence. We also need to partner differently with other organizations. If you look at the statistics, most of the women who are murdered are Black and brown women. And there are some leaders in this community that we need to hold up. Antonia Van, Mariana Rodriguez, Tammy Zhang, who's with the Hmong American Women's Association. So Antonia and I are in conversation looking at how we can change our work moving forward. As I said, this is unprecedented, and it's going to require that we act in a way we've never acted before. So those are my opening comments. I want to say we're deeply grateful for our partners. What happened in 2016, there was a young woman who was murdered within 3 weeks. I think it happened in 3 MPD districts. She was murdered in West Dallas in January of 17. We had been waiting for funding to start this team, and we all said to ourselves, we cannot wait any longer. So we've been doing this with existing resources since 2017, and the report really outlines the great accomplishments. I'm going to invite District Attorney John Chisholm to talk about his perspective and participation in DIVERT.
Thank you so much, Carmen, and thank you, everyone, for coming to pay attention to this critical issue. Stepping back for just a moment, we do have to keep in mind that despite incredible progress that was made with the formation of the Sojourner Family Peace Center and the collaborations that are all housed together, and that was an important sort of a transformational commitment by this community to treat violence that occurs within the home in a comprehensive way, and to focus in particular on the children exposed to violence. We saw tremendous progress. All of that was simply overwhelmed by the last 2.5 years, and that applies across the board. It applies to our office, it applies to the police departments, to fire departments, to social service providers, to school systems. All of the people that have collaborated to do exactly what Carmen said, is to be proactive, is not to wait for the tragedy to occur and then respond to it. Unfortunately, because of the overwhelming tsunami of violence that we've experienced and the degradation of resources to address it, we have been thrown into a purely reactive mode. But I will simply say this: thank God for the Sojourner Family Peace Center. Were it not here, the problem would be exponentially worse than it is right now. It is bad right now. Without the Sojourner Family Peace Center serving victims to full capacity, working well beyond their capacity, quite frankly, we'd be in even greater hurt than we are right now. So again, thank you, Carmen. Now, one of the commitments is not to be reactive, and despite the challenges of trying to deal with the cases flowing in each and every day, we do try to step back from it and see the big picture. We do try to identify the things that we can do to prevent these tragedies from occurring, and to, when we intervene, that the intervention is effective, that it does what we want it to do, which is stop the violence and then start restoring health and safety to that family so that they can re-enter the community in a safe way. That's our ultimate goal. Our ultimate goal is so that everybody that has contact with us gets to re-enter the community in a safe way. This is what the high-risk team does. It prioritizes the cases that need to be prioritized, and it has a long history. Carmen mentioned the lethality assessment. Milwaukee County, with the domestic violence unit being one of the first in the nation to adopt it countywide, with our law enforcement partners buying into it 100%. Having a witness protection team, a dedicated witness protection team in the district attorney's office has given us assets. Having our phenomenal victim advocates working with Sojourner's phenomenal victim advocates. All of these partnerships working together can and will continue to make a difference. We have to get through this time period right now. That's the best I can say. We are overwhelmed. We are doing everything we possibly can to get back to normal. And when I say get back to normal, getting back to normal meant that we had huge challenges. Even back in 2019, we had huge challenges. Those are just compounded now. But we're going to get there. We're going to get back to the space where we're going to have the ability to focus on things like our high-risk team, so that we can be proactive and we can start pushing these numbers to the point where these don't occur anymore. That there will no longer be a category under homicide of domestic violence-related homicide. That's our ultimate goal. So again, thank you, Carmen, and thank you to all of our partners here.
Thanks, John. You're going to hear now from Michelle Copens, who's the coordinator of our high-risk team. She is the engine, I think, that makes this team work tirelessly. So, Michelle?
Thank you, Carmen. Good morning, everyone. My name is Michelle Copens, and I'm the coordinator of Milwaukee County's Domestic Violence High-Risk Team. I am so very, very proud of the work of every single member of this team. Their work is life-changing, and it is life-saving for survivors of domestic violence. They have tirelessly dedicated themselves week after week to doing all that is possible to stop more domestic homicides from happening in our community. We know more now than ever before the red flags for lethal violence. And we know that many of those red flags have nothing to do with physical abuse. But we cannot intervene if we don't know that somebody needs our help. The vast majority of domestic homicides in Milwaukee County have no prior reports to law enforcement, and victims have not reached out to Sojourner for help in those cases. So please, if you are experiencing abuse or violence, tell someone. Reach out for help. Confide in a confidential advocate from Sojourner or another domestic violence organization. Reporting to police is always an option, but it is not your only option. If you're not ready to leave, that's okay. And if you're not sure if your situation is high risk, we can help you find out. What's happening to you is not your fault, and there is always a way out. Connecting with an advocate will increase your odds of surviving. So please, when you are ready, we are here. Thank you.
One of our additional partners is the Department of Corrections. Neil Thornton, who is the Regional Chief for Region 3, will talk about their participation on the team.
Good morning, everyone, and thank you, Carmen. As was mentioned, my name is Neil Thorson. I'm the Regional Chief for Probation and Parole in Milwaukee County. I've been a practitioner in community corrections for over 20 years. For several of those years, I specialized in working with individuals who were perpetrators of domestic violence, and in fact, for some time, I was able to work under the tutelage of Carmen as an employee of the Sojourner Family Peace Center, where I helped facilitate domestic violence intervention groups for Spanish-speaking men. Our partnership with the Domestic Violence High-Risk Review Team goes back to inception in 2017. We recognized very early on the importance of collaboration and the link between collaboration and client accountability, survivor safety, and also client rehabilitation. Presently, we have 4 agents that, above and beyond their normal caseload duties, contribute to the Domestic Violence High-Risk Review Team. These contributions take many shapes and forms. Principally, our agents prepare for the reviews by providing information both for clients on active community supervision and individuals that have a history of being supervised by the Department of Corrections. In fact, in the summary that you have a copy of, you'll see some statistics related to individuals on active supervision and individuals that have discharged but have a history with us. Those agents, in addition to participating in the high-risk review team meetings, then will take information concerning those that we are presently working with and formulate supervision strategies with the ultimate goal of increasing survivor safety and ensuring that our community is not further harmed by those under the direct supervision of the Department of Corrections. What's more, recognizing some of the recent rise in lethality involving individuals in our community and those on active supervision, we've made the decision to co-locate one of our agents here at the Family Peace Center. That agent spends upwards of 3/4 to 100% of her time collaborating with the other partners in the building, wherein then they're able to gain real-time information and share those documents with our agents of supervision so that we can ensure that we're as responsive as possible and can be as proactive as necessary in order to ensure the safety of our community and provide our clients with an opportunity to change. I mentioned that our 4 agents that work in this capacity do this above and beyond their normal duties, which are monumental and important, and we're doing all that we can to ensure that if the Domestic Violence High-Risk Review Team does have the opportunity to expand capacity, we'll be right there alongside them and do the same. Thank you.
Thanks, Chief. As you can see, we're ever evolving our partnership and our collaborations. There's more to do. So today's not just about celebrating the positive results of what we've been able to accomplish, but to tell you we have much more to do. Assistant Chief Paul Formolo is going to talk from MPD's perspective.
Thank you, Carmen. Good morning. Again, my name is Paul Formolo, Assistant Chief of the Criminal Investigation Bureau for the Milwaukee Police Department. And Carmen, Michelle, very grateful for our long-standing partnerships between the Milwaukee Police Department and Sojourner Family Peace Center. Very grateful for the work that you do for our community. I also want to recognize my Sensitive Crimes Division Captain, Lucretia Turner, and 2 of her staff members, Police Officer Cindy Carlson and Deborah Stacy. Cindy and Deb, they're on the Domestic Violence High-Risk Team, and they're at the front of this problem, addressing these issues. And the work that they're doing along with Carmen, here are clearly saving lives. And the data and the research has shown that over the last 5 years. Although we're highlighting the success of this team, we still have our challenges. We still have a long way to go. Unfortunately, I have to stand before you today and report to you that we've had 14 domestic violence-related homicides already in 2022. 13 of those homicides involved a firearm. So clearly we have more work to do. But from the research that I read that was provided to me, it's remarkable what the data shows in there is that although it's still one too many, one death of a person that was staffed, or of a survivor victim that was staffed in this program was a homicide victim. Overwhelmingly, the majority of our homicide victims and domestic violence related cases were not staffed, nor were the offenders. So that clearly tells me that this is a successful program and we need to find ways to expand this team. And I'm always looking for new ideas, innovative ways where we can provide interventions and mitigate. I just want to take a moment to kind of highlight one of these ways that we do this within the Milwaukee Police Department. On a weekly basis, we hold what we call our public safety review. And for the most part, we're analyzing and evaluating our shootings that occurred in the prior week. A component of our public safety review includes what we call the Firearms Denial program. This program is, we receive information from our state and federal partners of individuals who are prohibited from possessing firearms. These individuals, for whatever reason, are not allowed to possess a firearm or purchase one. However, they will still make an attempt to purchase a firearm from a local firearms dealer. We receive that information. And what we've noticed is, and oftentimes in these cases, is that these prohibited persons were recently arrested or involved in a domestic violence case. So to us, that shows us that's a red flag of some type of escalation take place. And we immediately take some type of an action, enforcement action, to address that issue, conduct an investigation. So that is one way of trying to be proactive despite this violent crime wave that we're in. We are taking notice of what's taking place in our community, and we're trying to be innovative in finding ways to address it. So yeah, again, Carmen, thank you again for your partnership and allowing the Milwaukee Police Department to participate here with you today. Thank you.
All right, so we have one more chief who's going to speak, and then we have a couple of survivors who have courageously agreed to come and speak to you today. So Chief James Mcgillis from Wauwatosa is here, but he's also the chair of the Domestic Violence Subcommittee of McLEA, which is the Milwaukee County Law Enforcement Executives Association.
That's a mouthful.
Very important, lots of letters. He's going to speak to you today about their participation.
Thank you, Carmen. I'm going to keep my comments very brief. I was honored and privileged when Carmen asked to partner with the Wauwatosa Police Department in its advocacy campaign, its awareness campaign of Always a Way Out. It makes sense because law enforcement, that is a critical point in people's lives where we intersect when people are in crisis and in a bad situation where we can make a difference. Whether it's holding an offender accountable, whether it's assisting a victim to become a survivor of that incident and really help break that cycle of violence. Domestic violence is a crime that knows no racial, gender, socioeconomic, or relational boundaries. And as public safety leaders, we consistently work together to hold those accountable for the crimes they commit while supporting the victims of intimacy-based crimes to break that cycle of violence. Developing hope for our victims is critically important while providing direct support services to survivors, and we do that through our partnerships. The good news is that all of our partners up in front, we all know each other, we all have history. We're all earnest and zealous about continuing to work together. However, hope is not a strategy for us in law enforcement, as we need and consistently use data to inform us of what is working and how we can improve all of those systems and processes in our respective roles. Sojourner Family Peace Center's high-risk team and the report provides that data so we can all continue working to effectively reduce fatalities and break that cycle of violence. I am proud to stand with Sojourner Family Peace Center and my partners in Frontier to bring awareness to the realities of intimacy-based crimes and violence while applying data and research to improve our role so we can assist victims break that cycle of violence. Thank you, Carmen.
There's nothing that you're going to hear today that's truer than what you're going to hear next from two survivors who have agreed courageously to share a little bit about their experience. I'm going to introduce Jennifer and Amara and invite them up to say a few words. Want to come together or separately? Whatever works.
Thank you. Thank you, Carmen. Thank you for having us here today. Appreciate it. My name is Jennifer Moston. I'm a survivor of domestic violence. I truly, truly believe if it weren't for Sojourner and law enforcement and courts, that I would not be here today. I cannot thank everyone standing here enough for all of the work you are doing. To kind of give you an idea of my experience, thank you especially to law enforcement who are listening to survivors and trying to figure out ways that you can find out who's in a lethal situation. Unfortunately, when police were called to my house when my husband strangled me, they questioned us in the same room. And unfortunately, and this was not Milwaukee County, this was Waukesha County, but unfortunately, they didn't know. I don't know if they didn't have the training, but they didn't know. They questioned us in the same room. Of course, what was I going to say? They kind of just left the house, and I was in the worst situation that I possibly could have been. Then we got to court, and thank you so much for what you're doing, listening to survivors. Family court did not protect me and my son, but our district attorney in Waukesha County was amazing. The criminal judge was amazing, and they really listened to us. So thank you for listening to survivors and really hearing what we have to say and understanding how dangerous the situation truly is. The lethality assessment is huge. Unfortunately, I did learn that once a person gets to the point where they will strangle their victim, the next attack most likely is death. And again, thank you for listening to that. One other thing I want to mention is thank you to the Department of Corrections as well. My abuser is in prison, and there's not one day that goes by that I am not scared to death for that day in 5 years where he walks out. So thank you for listening for survivors and understanding what needs to be done in the prison system with corrections as well. Thank you, Sojourner, for everything you do, for listening to us and reaching out to survivors. Thank you.
Sorry guys, just gonna get myself prepared here. All right. Hello everyone, my name is Amira, domestic violence survivor and advocate. I'm so pleased to be here this morning to empower and highlight Sojourner's work, especially their high-risk work. I've been lucky enough to have had consistent support from Sojourner since 2019. And let me tell you guys, 2019 me is not the me that's standing in front of all of you guys today. I speak with resilience and pride because I was once too weary and skeptical about helping myself, right? And at the time I was being physically, mentally abused, as well as my character was being defamated. So you can imagine at that time my hope was slim to none. From the restraining order clinic to the Hope and Healing Center, I completed that group, and I never realized that they were all puzzle pieces that would come together today. Statistically, it shows that 99.93% of those who came to Sojourner have survived, and I'm one of them. And I'm so lucky to be here, and I'm so grateful. I was empowered and humbled and challenged not to only put myself first, but to love myself during the entire process. And I want you guys all to do the same, but at your own time and in your own ways. I want to also take a moment today to thank Miss Liz, who is retired. But she was one of the group one of the group facilitators here at Sojourner. And she challenged me to refocus my energy toward my healing and thriving process. And again, I want you guys all to do the same, but in your own time and in your own way. Thank you.
Thank you so much. A couple of closing comments before we open the floor. I want to let you know Dr. Erin Schubert is here. She is our in-resident evaluator. We're the only center in the world that has an evaluator on site. She can talk to you about the analytics and the statistics behind the report. You heard a lot about Sojourner today and our great work. We have incredible people who do this work here, which we consider human rights work. But I know today there's a young girl sitting somewhere in this community, and she won't ever get on the bus or drive her car down here to 6th and Walnut. She's the person that I'm concerned about. She is the one who we have not yet opened a door for. And we are responsible for making sure that we change our work so that we can open doors differently for people. It's not only about telling you about our great work, but what's our responsibility. We need every church, every school, every medical setting, every street in this city needs to be engaged in this issue. You heard from Michelle, you don't have to call police. If you don't feel comfortable doing that, I would say don't. Call a program. If you reach out to one person, you're more likely to survive. We hope it's us, and if it's not us, we hope it's another program. If it's not another program, we hope it's someone in your life. Because when you begin to break that cycle of isolation, it could be what saves your life. So please reach out to someone. I get asked a lot, what can we do? And I often say to myself, I think we underestimate the power we have as human beings to make a difference right in the 5 feet that we stand. If you took it upon yourself at work, at school, at church, in your community settings, to understand what the warning signs are, what the resources are, memorize the hotline number, 933-2722. Understand what it means to build a bridge to a program, and then be a safe person. If someone comes to you and says, this is happening, be a safe person. Survivors are counting on us for support and to help to build the bridge. So with that, we'll conclude the formal remarks, and you're invited to do individual interviews or talk or ask questions now. Yes, ma'am.
Although there are programs like, or organizations like Sojourner, we still see that the number of domestic violence victims are still rising.
Yep.
What is the cause of that, and what are you guys doing to help with that? Is it enough? And
Well,
so this is for the district attorney.
okay. John?
Sure. Every single one of them is one too many. And we don't define ourselves by our victories. I could do press conferences every day talking about something that we have done successfully, like a successful domestic violence felony prosecution, of which we have very, very many of them because of the relationships we've developed here. But we don't talk about those. We're driven generally by the desire to prevent these from rising. And the circumstances we find ourselves in right now applies to everybody up here right now, every single partner. We understand the urgency that people are experiencing with the level of violence. You have unprecedented numbers of people dying from overdoses. You have the reckless driving. You have lack of access for people that have mental health issues. There's just across the board, the non-fatal shootings and the fatal shootings are unprecedented. And all of those have to be responded to. And they're being responded to in a context where there's fewer and fewer resources to do it. That's the challenge right now. And the one thing that we have to commit to is not leaving the gems like Sojourner Family Peace Center without the resources to do their work. We have to make a commitment as a community to adequately resource the people that are doing. Everybody here is fighting well above their weight class. And what I mean by that is they're doing incredible things, but we're always driven by the failures. We're always driven by the things that don't go right, because that's our obligation, is to try to create a community that's as safe and healthy as we possibly can. But this is a tough environment to do it under. Nobody is avoiding that reality, and nor are we sugarcoating it. So it's going to take us some time. Some of the positive things you saw recently, that the state, the governor, committed additional resources to the Milwaukee County criminal justice system that allows us to hire more prosecutors, more public defenders, more advocates, more witness protection services. Again, my goal is to get us back to sort of that 2019 timeframe, which again was not perfect. We were all committed to improving the system, but we have significant challenges ahead of us, and it's still going to take us some more time.
John?
Yes, yep.
Of the 7 women killed in the past 3 weeks, looking at our records, can you tell us how many of the suspects that have been caught, how many of them were repeat offenders? You must track them.
You know, I wouldn't be able to give you that answer right now, but I could certainly find out for you. Yeah, I could answer that question just by looking into the numbers, and I don't know if MPD has those numbers, but we have been tracking through the violence reduction, public health, and safety teams. We're looking at trends like that. But that specific question, at this point in time, I don't have a direct answer for you.
What do you say to those who are critical of the criminal justice system, of people, offenders getting out and repeating these crimes, and getting their hands on guns when they shouldn't be?
Well, the short answer to that is you can just look at the numbers, right? And for example, most people don't realize that you have roughly 950 beds available in the Milwaukee County Jail, of which currently about 300 of them are occupied by people who have been accused of homicide, right? So when people are critical of the fact that people are out there in the community, the answer to that is what alternatives do you have? You're focusing on the most dangerous people in the community, and these law enforcement officials are doing everything in their power to hold them accountable, but even they, at this rate, are solving homicides at about a 50% rate, right? And you can't even start talking about the non-fatal shootings and the overdose deaths. So there's just an overwhelming problem, and it's all in the context of reduced resources, not more resources to try to address it. So when people are critical of it, I understand that. The short answer is if you want better results, you're going to have to invest more resources across the spectrum, and you're going to have to incentivize people to want to do this work. Because right now, there aren't a lot of people out there that want to do this work because of the challenges, and because all anybody focuses on is the negative. They don't look at these reports. They don't look, you don't get a report about the domestic violence unit having an incredible success rate on serious felony cases. You don't hear those stories, and I understand it. That's not the way we're geared as human beings. We're geared to focus on the negative. But you've got people, police officers, advocates, community members, everybody doing incredible work every day, and like I say, fighting above their weight class. The challenges are just immense, and if you're in this business, you just keep grinding away. You take the challenge before you and you move forward. You can't give up. If you give up, things become worse. We'll get there. It's just going to take some time.
As far as increasing the capacity and staffing for this program, what does that look like? Is that a matter of going to the county and pushing them to increase funds for this program? Is it going to individual entities that are involved?
Well, the challenge for us is I can't raise private dollars for John's office.
Sure.
The challenge for me, I've been thinking about this for 5 years. I cannot give private dollars to the district attorney's office. That would have to be state funding. We would need state funding for the police department, the district attorney, and the Department of Corrections. There's also some other things we're looking at doing to evolve our work. For us, we do a mix of, we have some government funding, and we raise private dollars to sustain our work. We've been in the Milwaukee Police District since 2006. We're looking at maybe evolving that work to on-scene response fully. So we have advocates in every district and the southern and northern part of the counties. We're looking at how to evolve that. We need additional resources because the caseload is too high. So we raise private dollars, but the federal government or the state or the county or the city should be looking at funding this team in its entirety.
Just to follow up on that, that's what we've been doing for my entire 30 years as a prosecutor, right? So the Milwaukee DA's office is a trifurcated funding source. It shouldn't be, but it is, and that means that the state pays for our attorneys, about 2/3 of the attorneys. The rest of them we get through federal funding, and every year we have to apply for grants to get the kind of resources we need to try to do the work that needs to be done, domestic violence focus being one of those things. And then the county provides the funding for our victim advocates and our investigators. So it's a very complicated mix. But you know what the circumstance for the county is with respect to its budget, no different than the circumstance for the city of Milwaukee and for its police department and for its fire department. They are being cut. They are not being given more money. They're going to be given less money. The same's been true for the county for a long time. And until this ARPA funding has come through, and that's only short term, that's going to be for about 2 years to try to get us back to where we're going. So again, when I get the criticism that we're not doing enough, part of the challenge is that we've been doing so much with so little that people sometimes become accustomed to us doing incredible things with next to nothing. They just become accustomed to it. Yeah, well, just keep going, keep plugging away. Until something like the last 2.5 years happens, and then people are expecting you to jump right back to where you were in 2019, and you just can't do it because that infrastructure was under tremendous amounts of stress before this happened, and a lot of those struts have broken in the meantime, and trying to get back up to where you can become proactive again is going to be a huge challenge. But we're committed to doing that. We know it works. Things like this work, but they need resources. And you have to have the time and the space. We talked about it. We'd love to do this every single day. MPD would love to do it every day. Can you afford to do that, Paul? In other words, can you pull detectives off the street? Can you pull them off the street to not investigate current homicides so that you can analyze the past homicides? I'm not saying either one of them is it shouldn't be either or. You should always be able to say both. We're going to do both. We can't always do both. We just can't.
I just wanted to jump in and add to that if I can. We would absolutely be remiss if we didn't acknowledge that every single one of these partners has essentially volunteered their time and their staff and their resources for 5 years. They do not receive, any one of them standing here, one dime of funding for this team. Not one. So all of this work is in addition to whatever else they had on their plate and the existing funds and resources that they have. And when they were asked to participate after that homicide that Carmen mentioned earlier, their response was, how soon can we start staffing cases? So it was without hesitation, without money, without resources that they said yes and have continued to say yes every single week for 5 years. So I have to acknowledge that for them. So thank you.
Carmen, could you help me understand, not trying to, obviously, there's small number of individuals that have been staffed by Sojourner have died. And one victim staffed in 5-year history passed away, but then I looked at the 3 domestic-related deaths. Are you speaking actively staffed as opposed to previously staffed? I'm just trying to understand some of your numbers here.
Michelle.
Yeah, so in the 5 years, there has been one victim staffed by the team that was killed in a domestic homicide with the partner that they were staffed with. Certainly, sometimes people go on to other relationships where other things happen, but for the case that we staffed, there has been one. And one loss of life is always too many, right? But of the thousands of cases staffed, we are proud that most of those victims have survived.
And is there anything that can be gleaned from that of obviously what Sojourner and the successful outcomes that has been seen through this partnership, but is there anything that can be gleaned from that one instance to maybe try and help Sojourner and that outreach that maybe it wouldn't have that outcome?
The only thought that comes to my head with that is honestly that homicide occurred within the first 6 months of the team, where the model was still being formed and the process and the outreach and all of it was still being figured out. And so I think we were new in figuring it out and not at the top of our game, but very quickly got there, and there hasn't been a homicide since. So that homicide occurred in 2017, and knock wood, none of the cases since then have involved a homicide.
I want to just say something on the scale. That's one person of 3,131 cases that they staffed, so that's 0.03% of the staffed cases staffed ended in a homicide where the victim was killed by their abuser. And so, considering the scale, this model was developed in a small community in Massachusetts called Mcgillis. In the first 7 years of that small 131 in 5 years. And so the scale of the work that this team is doing is just not even in the same universe as other communities that have implemented this model. And so that's another thing to keep in mind
Yeah.
when we're thinking about it.
Thank you for clarifying that.
Yeah.
Yeah. I also want to mention Dr. Mallory O'Brien's work, which was a precursor to the LAP protocol. She started the Homicide Review Commission here in town, where we would get together. Sojourner has done this. We would put up a white sheet of paper and look at a person's life who had been a victim of homicide, and look systematically for places where we needed to make changes, or where something had happened that we wanted to try to prevent from happening in the future. So this work grew out of Mallory's work here in Milwaukee. It just gets us a little more proactive from the homicide actually happening. I also want to say, as John said, it's not like we had a system that was working really well before COVID. We had a very strained system. On any given day before COVID, you would have 35 to 40 cases scheduled for court on any given day. Now imagine if all 35 of those survivors had shown up. We have 3 domestic violence court. We started those in the early 90s, 1994. So we have massive amount of cases and not enough resources. And what's happened under COVID is everything has been broken and disrupted. Fair to say?
Yeah, it is fair to say, and we remain committed to the models that have been developed by Homicide Review, by this program here. It's a basic model that I learned when I was in the Army, right? Mac would agree with this. It's called the after-action review. And what it's predicated on is that when you're in a fluid, hostile environment and you have to make really important decisions, oftentimes with limited information and the urgency is immediate, you rely on your training, you make your decisions, and you move forward from there. You're not always going to have an optimal outcome. And when you don't, you have to be transparent about that, and you have to look at where you failed as a system. And this is what allows you to do that. Certainly the most high-profile system failure in recent memory is the Brooks case, right? Everyone understands that and acknowledges it, and what you do is you step back from it, and you don't run from it, you don't hide from it, you acknowledge it, that this is a part of what we do. We deal with incredibly difficult, discretionary decisions each and every day, sometimes that have life and death consequences for it. That's why we're in these positions, and that's why we take it so seriously, and that's also what motivates us to serve the people to the very best of our ability every single day, despite all the challenges.
When this team takes on a case, can you describe in general what steps it takes and what resources are required to maximize safety for a victim and accountability for the offender?
Yeah, so that's a really great question, and the short answer is it depends on the case. So some of the cases reviewed, everything has already been done perfectly, right? Every system has responded exactly how we would like them to. And then there's others that we review, and we find out that there's different interventions that could help. Maybe we need more help from law enforcement to locate and arrest someone. Maybe a victim needs security cameras or security measures because there isn't room at a shelter and she needs to stay home with her children and still be safe, right? So the resources can vary a lot depending on the case and what's needed. Some of them have far greater needs and some less so.
For you, Michelle, how long is the team involved with a specific survivor or case?
Sure.
When does that relationship start and end, or does it keep continuing for as long as that person wants?
Yeah, that's another, you guys have good questions. So it can be really, really fluid, and again, it depends on the case. Some of the victims who are staffed by the team already know us. They've already been connected, they have a history, it's just escalating, and it's now reached a point where it's lethal. So some of them we know and we know really well. Others, this is the very first time they've ever called police or ever talked to Sojourner in their life, and they're just meeting us. But all victims, we make every attempt to inform them that their case is being staffed and inform them that they're facing a lethal level of violence and that we are worried and we are concerned and we want to hear from them. And they have an opportunity to provide input back to the team to describe what they think from their perspective is going to keep them safer, which is really critical because our survivors are the biggest experts on their relationships, not us, right? So we love it when we're able to reach them and hear from them what would help. Some of them stay connected for years. Some of them are still working with us. Some of them have had their cases staffed more than once by the team because they are still living with violence and still living with abuse that is simmering at that lethal level. Yeah.
What have you found is some of the areas, obviously, I know you want to expand on on-site, on-scene, more immediate response, but in looking back at, say, instances of victims who have not had contact with Sojourner, where do you see there have been possible inroads to get them connected? Or I guess what's preventing maybe a domestic violence victim that hasn't had contact with Sojourner from being in contact with Sojourner?
I think Marcy's Law has caused, in addition to COVID, an intense amount of, it creates another barrier when, and it depends on how the officer asks the victim if information can be shared. That's the new constitutional amendment that was passed when we already had an existing constitutional amendment. I think Marcy's Law, we've seen a big impact and a drop. When you're asked on the scene, can I share your information? Maybe you don't trust systems and you don't want anybody to have your information. And if you say no, your information cannot be shared. So there's no outreach for you. I think distrust, sort of what we've seen happen after the George Floyd murder, was, bubbling up distrust between the community and systems. I think that has had an impact, definitely. I think there's a lot going on at the scene when there's an incident and you're calling for public safety. I personally believe you'll always have a need for public safety if you're being stabbed, set on fire, strangled, raped. You need law enforcement to respond. I think there's other instances where we could have opened the door and we did not as a community. That's what I mentioned, other softer, easier doors for survivors to walk through. So I think distrust, uncertainty, the disruption that's happening in our community are all contributors to why people might not be coming forward. We dropped, before COVID, we were at 12,000 clients. Last year we served 8,100, I think. So our numbers dropped. And I think some of it had to do with Marcy's Law and police not being able to make the referral.
So would you say that it sounds like, because you started off with Marcy's Law, that Marcy's Law actually has had an unintended consequence of preventing
Yes.
police, Sojourner, other agencies from being able to connect people with the help that they need?
Right, yes. I believe Marcy's Law has had an unintended negative impact. I also believe that we need to evolve our work, and there's a difference between saying to Dolly, hey Dolly, Carmen is here from Sojourner. She'd like to speak to you if you'd like to talk to her. That's different than saying, hey, can I give your phone number to somebody? That's why I think the work needs to evolve to on scene, because they're so chaotic, lots going on. And it's not like our connection rate after police give us the information was 100%, because our clients are mobile and a lot shifts within that 24 hours. So my belief is we need to do different work, and we also need to do neighborhood-based work, and we have some work starting in that area that Mr. Tristan Gross is in charge of. My belief is we need peers on every street in Milwaukee educated and doing outreach on this issue. It's not an issue we're going to arrest our way out of. That is not going to happen if that's what you're waiting for.
And if I could just add, I was going to highlight the fact that we are evolving in that direction already. So for homicides, for example, our crisis response team has been going to the scene. Those are victim advocates, and they're often not identified as DA employees because they're providing victim services. They're oftentimes identified with the police department, but they're on scene. Now, if you could imagine us having the equivalent for every domestic violence scene, for years it would be wonderful to have dedicated police officers who specialize in family violence issues. They can't do it because of the volume, but it would be awesome if you could have that kind. Having the community prosecution presence has been a huge asset for the community for a long period of time, some of which, particularly in District Number 4, have always focused the community prosecutor up in Number 4 sort of as a special focus has always been aligned with addressing the domestic violence issues as a community prosecutor and trying to connect those resources at that level. So again, from my standpoint, it's very similar to how you're trying to deal with mentally ill people suffering from mental illnesses. Get the police out of the equation if you possibly can, except for limited circumstances that have high risk involved. There's a firearm, there's a weapon, there's an immediate danger. If that's not the case, then nothing would be better than having trained medical professionals responding to that. Nothing would be better for the police, nothing would be better for the court system than to keep individuals that need treatment out of the criminal justice system and have them handled completely differently. And we're trying to move that direction too. So again, all of that is the direction we were going in 2019, and all of that has been compounded exponentially by the challenges of trying to dig out of the holes that we're in right now.
So we have a pilot project in District 2. We're working with the captain and MPD to return to on-scene response. In 2010, Captain O'Leary invited us into District 4. We brought the homicide rate down to 0 and kept it there with on-scene response. I do believe that that's the next evolution of the work, having an advocate, a prosecutor, officers working together. We have a forensic nurse who's agreed in the pilot to be with us, and the DA, the head of the DV unit, the captain of the DV unit has said she'll participate. I hope that's not news to John. In the pilot, we want to test it in District 2. If it goes well, I think the rest of our CDOT program. Now for Sojourner, again, unfunded, we raise private dollars for that. Aaron wants to make a comment, and then I think we should break for individual interviews if everybody's good with that.
Yeah, just in response to your question about how do we reach those folks that are connected, right? This is a great example of a partnership between Sojourner and the criminal justice system. These are people whose the violence has escalated to the point that the police are involved, right? But I think it's important from our agency's perspective to also open doors earlier in the trajectory. And so one example of that is a pilot project that we have undergoing to build this type of systematic referral partnership where we're screening everybody that comes through the door and making referrals to Sojourner or other providers in the community with the medical setting, right? So survivors are accessing medical care not only if something happens in an abusive relationship, but just standard medical care. And so making sure that medical providers are screening folks that they're providing care for and connecting them to advocates at Sojourner is a really critical way to open doors for survivors in the community before the violence escalates to the point that police are showing up at the door, right? And so we have a pilot underway at Freighter Clinic and an extension clinic to do just that.
All right, everybody good? We'll break for individual interviews. Okay, thank you so much for being here today, and thank you to our partners.
Thank